Hi everyone, Dr. Omitar here. We are doing another quick video on how to treatment plan your cases and placing dental implants in your on your cases. So this is a case that I worked before, and we have gone through processing the CBCT into the Blue Sky Bio, stitching our STL file into the planner, and now we are actually ready to go ahead and basically treatment plan the case. So if you would like to go ahead and see this case from the beginning to the end, and I go over the steps on how to go about doing this. So for those of you who take my course, it's definitely a great opportunity for you to check out these videos on my YouTube channel, Dental Implant Surgical Seminar, and subscribe there so you can basically watch these before the course or after the course as a reminder. Also, for those of you who like to learn how to plan your cases on a Blue Sky Bio Planner, or in general, this is not specific to Blue Sky, although there are certain things that I need to tell you simply because the program is designed that way. This could be anything. It could be a Simplant program or any other program that you may have in your office. But I basically point out different things to be able to read the CBCT, and those are the videos that you could go ahead and watch. As far as the technical portion of each case, you have to refer to the manual on your particular program if you have in your office. So here is the mandible that we worked on before. So again, I went through how to read the CBCT, what to look for, how to look for. It's generally a universal amongst all CBCTs and the planners that you may have. Now today, with this particular case, I want to just mark the nerve, and that's basically what we're going to go ahead and do in this video, and then we go on to making other videos on the same case so you could have a quick video. So now, without any further ado, we're going to go ahead and make and plan our nerve. So in order for you to go ahead and plan the nerve, the first thing I do is I click on to the area where generally the nerve I may find it. So first thing first, you need to go ahead and find the mental. So I can look on a 3D image, and here's my mental on the left side, here's the mental on the right side. So I'm going to click on to this area because I can definitely see the mental is in this area. Now, one thing I want to tell you is you could come up here. There's a gray scale in this area. Okay, you click on the gray scale, you bring it into your CBCT on your images, on any image if you wish, and you left click and you go across your image, and you could see that it just got a little lighter. Okay, now this format will not come off your mouse unless you go ahead and just press this button where it reverses. It's a trackball mode. You click it, and then it goes back to your scroll. It goes back to your pointer on your mouse. By the way, I have said it in the past in the other videos. You do not want to go ahead and sit in front of the computer without having a mouse connected to your computer, because it will be very, very difficult. So if you're coming to the course, please make sure that you have the right computer. You have the Blue Sky Bio Planner, which is a free planner on your computer, as well as a mouse. So here is your your mental. You click on to this area, and you could see now very clearly the mental foramen on your cross-sectional. Now you come up here, there is a add nerve on the upper portion of the planner. You click on it. Once you click on it, you can see a window opens up and it says add nerve. Now each mandible will require 4 markings, okay? And here how it goes, and you could go ahead and take a look. So you're going to see how the progression of the marking is going to be. So this way, each mandible you should have 4 marking on it, and this is how you do it. You come here, you press the button, it says add nerve. The minute you do that, your cursor changes to a scroll that's like a little thing over here that shows a nerve. You come out here, outside the bone, you left click, let go, come back inside the bone to the end, and left click again. Okay, so now you could see on a 3D image your nerve marking is sticking out. Okay, now once you do that, the first thing you have to do, you have to go back in this area and say edit nerve, so you could get rid of your nerve on your mouse, because if you do not, anywhere else you click, it will connect it to that area. So if you come across the arch, you would see a yellow line going across the arch to the other side. So you don't want that. So you have to deactivate your nerve first. Now we're going to go to the other side. You click pretty much where you think the mental is, and then you come to the cross-sectional, you scroll down. Okay, here it is. I can see this is your nerve in this area. Okay, now again, add nerve, beyond the bone, click, inside the bone, click. Okay, now you could see again in the 3D, here is the mental again. Now you go ahead and say edit nerve again, you deactivate, you come back. So now we got the 2 mentals, and it's fairly accurate. You can see how you are showing the nerve. Okay, then what I'll do after that is I maximize my panoramic view, and I scroll into the images to try to get the best image. Okay, so now here it seems like I have a nice image. I can go ahead, and the computer just basically saves what you're doing occasionally. So here is my nerve. Okay, let's get rid of this line. Here is my nerve. It's coming through in this area. So this is very clear. So now I go to again, add nerve, and I say click, 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 click. Now once I get to this point, I don't see the nerve anymore. Okay, so that shouldn't stop you from marking more, because maybe we want to place more implants in this area. So go back and now scroll again. You won't lose what you have done, and you won't ruin extra. Now you could see as I'm scrolling, now I can see the nerve. So I scroll back here, now I see a couple of more, come back, one more click, again scroll. Oh, I see a little bit more. Okay, so this is good. Okay, now I see edit. So now we marked the left side. Let's go to the right side. Okay, so here is my nerve. I can see this area very clearly. I go up here, add nerve, click, click, click. Again, scroll down. I can see now the nerve is going up here. Click, 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 click. Okay, so let's edit nerve, close, and now we can go ahead and take a look in the 3D image. You can reduce your density. Okay, so now you can see how you have marked your nerve, and that looks good. Just get rid of this for a second. So now we are ready to go ahead and make our plan for this particular case. I hope you like this video, and we'll talk and do more of these videos later.